Welcome to another episode of Smarter Anesthesia, where we study smarter, not harder. On this episode, we will talk about the 10 best ways to build confidence for the oral exam. Whether this is the first time you have taken the exam, or whether you have failed the exam, these tips will help you get the confidence you need. We cover a lot of ground in just one episode, but hopefully, you will begin to see that the concepts all come from the few basic Smarter Anesthesia fundamental hacks. Thinking about this exam, you might be getting a little nervous. For those who have failed, you may have a little PTSD. It's okay. We'll teach you how to transform that nervous energy into energy that will help you remember random facts. So let's begin with the question you all want to know. How do you build confidence? Number 1. Most people believe that having knowledge leads to more confidence. Wrong! Let's say that once more, just to emphasize how wrong that is. Most people believe that having more knowledge leads to more confidence. Once again, that is completely wrong. That underlying belief and perspective of the exam will get you into trouble. It's the wrong perspective, and it's the perspective of someone who will fail. The way to build confidence is to get used to pulling together whatever knowledge you have. It's the art of building connections and demonstrating knowledge with the limited knowledge you have. It's what you already do at work. Even when you don't know something at work, you force yourself to figure it out based on what you know, based on what you have seen, because someone's life depends on it. And just like in real life, if you are really confused, you should be humble about those limits and ask for help or look it up. For example, if on the exam they ask you, what is the half-life of cocaine? How would you answer that question right now? Think about it. If your grade depended on this one answer, what would you say? Are you getting a little nervous just thinking about how to answer this question? Are you only seeing a scary tree, which is this tough question? Or are you seeing the forest, which is the bigger picture? This question highlights the number one way to build confidence, which is to think creatively. Contrary to your instincts, having more knowledge, memorizing random factoids, reading more books will not give you more confidence. The hack to answering this question is to train your brain to think creatively. That is the number one way to build confidence. A seasoned student wouldn't get nervous about this question because they have listened to this episode so many times, and they realize that this question is a nothing burger question. So what's the Smarter Anesthesia answer? Doctor, what's the half-life of cocaine? The answer? To be honest, I don't remember the half-life of cocaine, but I do know that it's a stimulant, so I will be evaluating the patient's vital signs to see if the patient is hypertensive or tachycardic. If this were an urgent or emergent case, I would immediately look up this information because it would help me better anticipate the patient's anesthetic care. Alright, how did that sound? Was that info you already knew? It's not the perfect answer, but hopefully it sounded reasonable. Let's break down the Smarter Anesthesia answer. When they ask, what's the half-life of cocaine? What was the answer we gave? The answer that we at Smarter Anesthesia gave was, I don't know. That's the answer, I don't know. For clarity, There are only two options to answer this type of question. Either you know it or you don't. That's it. If you don't know it, then you have to start thinking creatively. We didn't just give up. We forced our brains to think of any information that would be pertinent to cocaine or drug use and anesthetic management. Did you see that it's not a knowledge exam? Your confidence will grow once you realize that you do have enough knowledge to answer any question. You just have to be creative. In summary, the number one way to build confidence is to practice finding creative answers using the limited knowledge you have in your brain already. Channel your inner salesman. Force your brain to get used to answering questions in different ways, especially when the question is something you do not know. This leads us directly into the number 2 way to build confidence, which is to master the smarter anesthesia I don't know technique. If you can answer the most difficult questions, you will be much more confident going through the exam. The most difficult questions are the ones that you don't know the answer to. You just saw us employ it on the cocaine question. To recap the I don't know technique, when you are faced with a question and you don't know the answer, there are 4 things you can do. You can choose to do 1, 2, 3, or all 4 of the techniques, whatever combination you prefer. So when you don't know something, number 1, tell me something you do know. Or number 2, tell me how it relates to anesthetic management. Or number 3, tell me how to safely take care of this patient. And lastly, number 4, tell me where to find the information. Those are the 4 I don't know techniques. But don't forget, you always need to answer the question, even if you don't know the answer. In this case, the answer will be, I don't know. That's the answer. But after you've answered the question with I don't know, you will follow up with things you do know. You will still continue to demonstrate knowledge. Let's hear the cocaine example again, and let's see if you can identify which of the 4 I don't know skills we are using. Doctor, what's the half-life of cocaine? To be honest, I don't remember the half-life of cocaine, but I do know that it's a stimulant, so I will be evaluating the patient's vital sign to see if the patient is hypertensive or tachycardic. If this is an elective case, I want to wait at least 5 half-lives to minimize any cardiovascular complications. If this were an urgent or emergent case, I would immediately look up this information because it would help me better anticipate the patient's anesthetic care. Alright, did you hear us use technique number 1, which is tell us something you know? We talked about cocaine and physical exam findings of hypertension and tachycardia. You knew that, right? It's not new knowledge. We also talked about drug metabolism when we referred to 5 half-lives. The answer wasn't specific to cocaine, but all drugs have the same pharmacokinetics. We are just throwing out any answers that gets us closer to answering the question, what is the half-life of cocaine? Our goal in using the smarter anesthesia I don't know technique is to demonstrate some knowledge even in the face of a question that we don't know. We also use technique number 2, which is to relate it to anesthetic management. We talked about the difference between elective versus emergent cases. Even though we didn't know the exact number of hours, we know that the management is different. Lastly, we used technique number 4 and loosely told you that we would look up the information. As you can see, we never told you what the half-life of cocaine is, but the examiner can see that we have enough knowledge to safely take care of the patient. We saw beyond the scary tree and answered the forest. The oral exam is not a knowledge test, it's a presentation exam. These random factoid questions are there to make you nervous and to see how you respond when you are stressed. It's not really the question itself, it's how the question makes you respond, and that's the forest. That's the bigger picture. Remember, to build confidence, the number 1 way was to answer creatively. And the number 2 way was to use the smarter anesthesia I don't know techniques. Here's another example to highlight the number 2 way to build confidence. Doctor, what is the mechanism of action for Ozempic or semaglutide? The answer, oh sorry, I don't remember the mechanism of Ozempic, but I do know that it slows down the gut and patients who continue on Ozempic should be considered full stomach. If I really needed to know that answer, I would look it up on UpToDate. Did you hear the answer to the question? What is the mechanism of action? Our answer was, I don't remember the mechanism of action. But did you see what we did afterwards? We went into the I don't know techniques. For this one, we used technique number 2, how it relates to anesthetic management, and technique number 4, where to find the information. If you can answer challenging questions, then the rest of the exam should be a breeze. The confidence comes from knowing how to handle all types of questions, especially the ones you don't know. The third way to build confidence is to hack your fear and give your memories context. Instead of letting fear dictate your performance, use the fear to help you. The strongest memories in our brains are the ones linked to an emotion. The stronger the emotion, the more likely you will remember it. Being embarrassed because you didn't remember something is a great way to use emotion to help you remember. Think back to your childhood. The memories you probably still have are probably linked to an emotion, whether it's a happy memory from the holidays or a sad one from losing a loved one. For this exam, use the stress to help you remember. Hack your brain, hack your amygdala, and use those emotions to help you remember factoids once and for all. Also, by practicing exam questions, it forces you to check yourself. If you don't remember something, you will look it up at the end of the exam. By looking it up after you try to answer the question, you will never forget that topic again. This is a much better way to learn because now you have context for this random factoid. Once again, you can look up information after you have said it out loud, not before. If you try to read a book to get knowledge, you are just going through a useless motion borrowed from the times you took multiple choice exams. It's wasted effort here because you won't remember it on the exam. When you read a book first, before answering out loud, your brain is seeing random facts after random facts. That's okay for a multiple choice exam because you can close your eyes and picture the page it's on. But that context won't help you on an oral exam. On the oral exam, you won't have time to close your eyes. You need to recall that factoid in the context of clinical management or in the context of a question. In summary, you can build confidence by studying smarter, hack your fear, and memorize factoids in the context of questions. You will feel much better knowing that you will only need to do a single pass on a topic, meaning you will take away the worry that you can't remember it all. If you can remember it on the first pass, that's a much more efficient way to learn. One and done. The number 4 way to build confidence is by seeing that the entire exam is one big pattern. If you can see the pattern, it's just rinse and repeat. There's nothing to be afraid of when you already know what's going to happen next. Every exam has a pattern. When you took the SATs or the MCATs, there was a way to look at the questions so that you can improve the odds of choosing the right answer. Unfortunately, this is the first time you are taking an oral exam, so you need to find the pattern for oral exams. Since you are listening to these Smarter Anesthesia episodes, we are literally giving you the pattern. You just need to accept the patterns as the right way to answer questions, and you'll be golden. It's just hard to sometimes accept the Smarter Anesthesia techniques because it's not how you are used to studying for exams. But if you listen to our logic, you'll realize it's the right thing to do. It makes sense. We are not asking you to master 100 different techniques. There are only 5 fundamental techniques, 5 different tools for your tool belt. That's it. To recap the 5 fundamental Smarter Anesthesia communication hacks, they are: number 1, answer and explain; number 2, induction technique; number 3, long differential or long treatment plan; number 4, I don't know technique; and number 5, using if statements to replace the weak words. That's it. There's only 5 Smarter Anesthesia techniques to answer questions. If you can master all 5, you will have all the skills you need to answer questions. Knowing that you can answer all the questions will give you the confidence to pass this exam. Hopefully, after listening to all these episodes, you'll start to see the patterns. We keep saying the same things over and over. We just say it differently over and over, so hopefully, one of these times you hear it, it will actually click in your brain. Talking about patterns, there is a pattern to the questions as well. The number 5 way to build confidence is to see the pattern in the questions. Number 4 was about seeing patterns in the answer. Number 5 is about seeing patterns in the questions. There will be hard questions, which we call the scary tree. Expect the scary tree, but don't forget to see the forest. Once you see the pattern and realize that all the questions are pretty much the same, you can focus on the forest. It's not that you will see the same question literally, it's an analogy for the types of questions you will see, and there are only 3 types of questions. Number 1, there will be questions you expect and know. Number 2, there will be questions that you don't know, but you can reason through it. And number 3, there will be questions that you have no idea at all. You have to be able to address all of them. If you have mastered the I don't know technique, then there's nothing to fear but fear itself. Hopefully, by the end, the oral board questions won't scare you anymore, so you can focus more on the forest being the bigger picture. Beyond the question itself, you are trying to figure out what's the importance of this question to anesthetic care or patient safety. You're just trying to demonstrate knowledge. That's the forest. We have an entire episode dedicated to the forest, titled The Passing Mindset and Seeing the Forest, if you want to get a deeper dive. All questions are essentially the same, and all answers are essentially the same. See those patterns, and your confidence will follow suit. The 6th way to build confidence is by training 2 things, your brain and your mouth. Those are the 2 patterns you have to master. How to think about questions in your brain and how to answer questions verbally. Once you have trained your brain and your mouth, you become more confident because you have all the skills needed for an oral exam. Obviously, this is easier said than done, but at least you can strive to train your brain and mouth to master the oral exam. For your brain, you need to train it to prioritize and quickly compare the A and the B of a question. Every question has an A and B, a yes or a no, propofol or etomidate. Your mind should be quickly able to defend the A and then quickly defend the B. Of the 2 paths, whichever is easier to defend is the answer you will say out loud. You get to choose your own adventure. Choose the easier adventure. Quick note, the examiner will probably force you to go down the harder adventure, even if you pick the easier one. But it's okay, because you have already considered both A and B. It shows flexibility if they force you to go to B, when your preference was A. You also need to train your brain to think creatively, especially when you don't know something. As we said before, when you don't know the answer, tell us something you do know. It's a difficult skill to develop, but one that is necessary. Force your brain to find connections when the question is hard. If you practice anesthesia, you have enough knowledge. Just like in real life, don't give up. You do know something. You just have to train your brain to think creatively. We just talked about this with tip 1, remember? If you already forgot, just hit the rewind button. To recap, for your brain, you need to train your brain to quickly prioritize, quickly compare the A and the B, and creatively answer the question, especially when they are hard. For your mouth, you need to train it to explain your reasoning. You should always use the answer and explain format. As we just mentioned, there are only 5 smarter anesthesia communication hacks. You just need to train your mouth to use one of the 5 communication hacks, whether it be the answer and explain, the induction technique, the long differential or long treatment plan, the I don't know technique, or if statement. That's it. You will have more confidence if your brain and your mouth are on autopilot and you don't have to stress about how to answer questions anymore. This leads us to number 7. If your brain and your mouth are on autopilot, you should notice that the way you think and the way you speak at work starts to change. You will see your confidence increase at work because work becomes easier when you are thinking and speaking the right way. That's how you know you are studying for the oral exam correctly. Building confidence at work will help you build confidence on the exam. Study smarter and hack your way through this exam. Every day at work is another day you can practice for the oral exam. You don't have to set out special time because you will be practicing it all the time at work. For tip number 7, build confidence at work, and you will have it for the exam as well. All that sounds fine and dandy when you aren't stressed, but this leads us to the number 8 way to build confidence. When you are stressed, like on your real exam, your old habits might come back. To make sure it doesn't sneak back in, you need to simulate a stressful situation to force any bad habits to come to the surface. You can try to do practice sessions when you are post-call, or when it's very late or very early in the day, like at 11 p.m. or 5 a.m. You need to know what your brain does when it's stressed, because on the exam, you will be stressed. What patterns will come out of your brain and mouth when you are stressed? Are they your old bad habits? Or will they be the new ones you've learned from smarter anesthesia? Once you have reliably changed the way you think and the way you speak, you will be confident that you can do it on the exam, even if you stop thinking. You need to break the bad habits and develop good habits. Of note, the reason we use the word good habit is because it's something you want to do automatically. You should be doing the right thing without having to think about it. When you are stressed, like when you are taking the exam, you just want to go into the good autopilot mode, not the bad one that you used to use for multiple choice exams. If you break the bad habits early, then all you have left are the good habits. If you can develop good habits in your brain and your mouth, then the confidence comes knowing that you will be thinking and speaking the right way, even if you are in zombie mode. This leads us to the number 9 way to build confidence. Use reflection to figure out your bad habits. If you know your weaknesses, you can actively work on tackling those weaknesses. Head over to the episode called Passing Secrets Using Reflection to go into more detail. By reflecting on yourself, it will help you understand the problem you have. How do you know what to fix? How do you know how much studying time you will need? And what's the best use of that time? Whenever there's a problem, whether it be the oral exam or any other personal problems, the first step in fixing the problem is to recognize that there is a problem. That's the same reason why the first step of Alcoholics Anonymous is recognizing and accepting you have a problem. Those who fail can't see the problem or can't see the purpose of this exam. That's why they study the wrong way. In a nutshell, to figure out the problem, you need to figure out what you believe is true and get feedback from others to see what really is the truth. Our goal is to get you to see the forest, but we can't drag you to the finish line. We can only show you the path, but you have to walk the path yourself. Just like in real life, we won't be next to you in a difficult case, nor will we be with you during the exam. But we will have drilled into you all the skills you need to do the right thing when it matters most. By reflecting and truly understanding your gaps, you will have the confidence to tackle your problems efficiently and effectively. Our very last tip to build confidence is knowledge. Wait, what? Yes, we said it. Knowledge. But let's give this last tip some context before you jump to conclusions. We don't want you to open a book and start studying because that's not the problem. Although we constantly emphasize that this is a presentation exam, we also want to be fair, and we do acknowledge that knowledge does play a factor in your confidence. It makes sense that if you know more, you will have less chance of getting a hard question or a question you don't know. However, we hope you realize now that it doesn't really matter if it's a hard question or an easy question. It's because you should be able to tackle all those questions using smarter anesthesia techniques like the I don't know strategy. Nonetheless, the feeling of not knowing enough is universal, and it does affect your confidence, even though we are trying very hard to let you know that it's not really that important. Perhaps after you have passed this exam, you will truly understand why we say that knowledge is not that important. This test is 80% oral presentation techniques and 20% knowledge. Most people think it's 80% knowledge, and that belief will lead you to fail. Let's say it once more because it's so important. This test is 80% presentation techniques and only 20% knowledge. Most people think it's 80% knowledge, and that is the belief that will lead you to fail. For more on this topic, jump over to the episode titled Top 5 Reasons People Fail. The biggest bang for your buck will always be investing in your communication skills, not your knowledge base. As we mentioned before, you can read books after you have tried to creatively answer the question. Knowledge does help, but it should be in the clinical context of a question or anesthetic management. Hence, we say that this test is 80% presentation and only 20% knowledge, but the knowledge comes after you try to verbalize an answer. Alright, on today's episode, we covered many things that you have heard before. We will keep saying it over and over. It's not any new information. It's just a different way to see the same smarter anesthesia skills. We are saying this because we don't want you to feel overwhelmed about having to learn so many new skills. They are all the same ones, just different applications of the same thought. To recap, today we talked about the top 10 ways to build confidence. At the very top of our list is number 1. This is not a knowledge exam. Your feelings of having to gain more knowledge is misguided and will lead you to fail. Instead, you need to practice for an oral exam by talking. Our number 1 tip is to force your brain into finding creative answers. It's a skill you need to master to build your confidence, not memorizing more facts. Number 2, use the smarter anesthesia I don't know techniques to help you be creative with your answers. Number 3, hack your fear and give your memories context. Use your amygdala to help you remember facts. Give your memories context by reading a book after you have done the questions. You need the clinical context so that you can retrieve that memory easily on the exam. The number 4 and 5 way to build confidence is to see the pattern in the questions and the answer. All the questions are the same. Don't be scared of the trees. See the forest. You should not be surprised by the questions because you have figured out the pattern. Also, all your answers will be the same because you will be using the 5 smarter anesthesia techniques. Confidence comes when you aren't surprised. The number 6 way to build confidence is to put your brain and your mouth on autopilot. Up until this point, you have trained for multiple choice exams. You have trained your eyes to read and your hand to write notes. Those are not the skills you will need for an oral exam. Train your brain to prioritize, to see the A and the B, and to creatively answer questions. Next, you will need to train your mouth to answer using one of the 5 smarter anesthesia techniques. Number 7 is to practice these skills at work. If you are studying for the oral exam correctly, you will start to notice that the way you think and speak at work changes. Whether it's a real patient or one that's on the oral exam, your confidence will grow when you realize that work is getting easier. The patterns you are mastering for this exam are the same patterns you will use in real life. It's a win-win situation. Number 8 on the list is to break bad habits and get good new habits. When you are studying, your goal is to simulate a stressful environment. That's when you will see the bad habits coming out. So if you are short on time, study post-call or late at night. It's okay. It's an opportunity for you to see what happens when you are in zombie mode. Number 9. Reflect on what you believe is the problem and seek feedback to make sure you are actually seeing the right problem. Confidence comes when you know you are heading in the right direction. Lastly, number 10. Having more knowledge does help you feel more confident, but it's not in the way you think. The knowledge comes after the presentation because 80% of this exam is presentation. The return on your investment is so much higher if you focus on your communication skills. If you are studying 10 hours a week, 8 of those hours should be dedicated to oral presentation, and 2 of those hours should be reading. Remember, the reading happens after the talking. That's it for this episode. Today we covered the top 10 ways to build confidence. If you found this session helpful, hit the like button and subscribe to get notification when we release new episodes. Feel free to email us at smarteranesthesia@gmail.com anytime. We're here to help you. We offer a 15-minute evaluation, give you customized study tips, and help point you in the right direction. It's all free, just like this podcast. Alright, continue to email us feedback and suggestions, and we will continue to improve this community. Until next time, study smarter, not harder, from your host of Smarter Anesthesia. Talk to you soon.